And then if we follow that facial nerve back, you can actually see that ventral buccal branch coming off right at that point. And by the way, the lab guide does tell us to find the regular temporal, which we found earlier. Just didn't think it was in the lab guide, so it does tell us to find that. A couple of quick things it mentions in the lab guide to try to find. So we won't spend too much time, but first of all, the dura mater, which is really fused with the periosteum, so that's that. It says to find the subarachnoid space, but that's really going to be collapsed down in the brain, and it's going to be hard to find that. It says to find the falx cerebri, so you have to go to one side of the brain to find that a little better. That's just that midline thing that's coming down right there. The tentorium cerebelli is this. Which one is best here? There's a little.
This piece here.
There's a little jutting thing coming in there. Bone, is that? Is that what that is? No, that's like dura also or something?
Yeah.
Dura also, and then the dorsal venous sinus. You can see over here, dorsal venous sinus. Underneath here you see the rete mirabile. It tells you to find the hypophyseal fossa, the sella turcica, the pituitary gland. Those are hard to find. You'd have to get underneath here, look below the hypothalamus there and the diencephalon, and really that's about what you. And the cisternum magna is all that right in there. What do we call that? First we call that cisternum magna, by the way, the cerebellomedullary cistern. There are some differences here in this nasal cavity that we need to point out, but we're trying to find first of all, the nasolacrimal opening, and see how that is really quite different than it was in the horse. You see how caudally placed that is, and it's almost like it's on the, that would be the alar fold, right? Yeah. By the way, that is the alar fold there, and then there's a straight fold, which is up there. And first of all, let's look at the dorsal concha there, and then the dorsal meatus is above that. The middle is over here. The middle concha is that. And then you have the middle meatus around that, kind of coming back to it, and then ethmoidal meatus is, I think, are above and below it. Now, what gets confusing is the ventral concha. It's really quite large, and it's almost divided into two parts here. So that's all ventral concha, and then the ventral meatus is down right here. So we're looking now for the incisive papilla. You have to probably on one side it'll be cut and show up a lot more, but that's the incisive papilla where the incisive duct opens. That's for kind of there on the dental. Is that the dental pad? Is that what that is?
Up there.
Yeah, on the dental pad. Just call it a little bit dental pad. Find some highlights, some structures here now. We're looking at the down on the oral cavity and the oral pharynx actually. The palatoglossal arch is similar to the way it was in the other species right there. And so then if we look up from the base of the tongue, sort of on the wall, you see sort of some openings. In the case of the goat here, I think in the bovine that'll be more like a slit. That's called the tonsillar sinus, and that's where one locates the palatine tonsil. Then the pharyngeal, or the palatopharyngeal arch, is running there. And then if we go up into the nasopharynx, we can see pharyngeal tonsil right up there. And then kind of in that area is where the opening of the auditory tube is, and then that would be, there's some tonsillar tissue around that, sometimes called a tubal tonsil. All right. Locate the sublingual caruncle and the frenulum. It tells us to find the sublingual caruncle, which in this particular goat at least is not very obvious at all, but that's where it should be, down there at the base, right down there. And then the frenulum is simply that fold there, right there. And then we find the torus linguae, which is this bulging caudal part of the tongue, and then there is a groove here that is called the fossa linguae. Tells us to find some things. Let's first of all find the piriform recess around the base of the epiglottis. That's just that whole space around that allows food to travel around it and fluid. And let's see, what else were we supposed to find? The piriform recess and the cornicula process of the arytenoid, which is that. The whole aryepigotic fold then is right, of course, there. We're supposed to then find and also notice it does tell us that there's no such thing as a lateral ventricle, really, or a laryngeal saccule in the ruminant. Can we find the vocal fold and stuff? Have we? Not really at this point. Okay, so then we're supposed to try to look at this hyoid apparatus. We're supposed to look at. We're supposed to try to find, and it really gets confusing here. Now, apparently in goats, this is a goat. Now, in ruminants, there is a small lingual process, but we couldn't really find one in the goat. And usually this is cut off to one side, so things do get kind of confusing. We actually dug down, cut through the base of the tongue to show the other side of the hyoid bone. So the base of the hyoid here really hasn't been cut, so it's kind of just connecting everything. Then you see the thyrohyoid bone on that side, and then on this side, this is the thyrohyoid. And then what do we have? Epihyoid on this side and that side. So we have epihyoids on both sides. So we can see here we actually have not cut through the middle of the hyoid apparatus at all. Now looking at the larynx, we've cut through the larynx to open it. And in ruminants, there are no lateral ventricles or laryngeal saccules. There's no midline, or there's no median ventricle, although it looks suspiciously like one here in this goat, but supposedly there's no median ventricle either in that. And then, of course, the vocal fold is hard to see. It isn't as prominent as in other species, but there it is. It's just harder to see because there's no lateral ventricle. And then the rima glottis is just the opening of the glottis. That would be right there. Starting a new dissection. We're starting. This is a session here, but this will be for at least for part of this will be for Thursday's laboratory. But here we have we're looking at the kind of these superficial muscles here. You can see the latissimus dorsi. You can see the serratus ventralis, thoracus peeking through there. And then as you can see, we've taken out the cutaneous trunci muscle. It's been reflected. It's gone. But we have some fascia and fat remaining in this area. Peel that back carefully, and you look down. It doesn't contrast very much here, but there's a fairly large nerve right on the inside of that fascia when you peel it down, and that is the lateral thoracic nerve. There should be a vein somewhere in that area, which is the lateral thoracic vein called the spur vein. That vein, it is technically called the external thoracic, and then the horse would call it that, but also it's called lateral thoracic, especially in ruminants. Let's see, what else do we have? Anything of note here? I guess that's about it. We have done a rib resection, or we're working on a rib resection here now. We've actually chosen the 6th, which is a little bit, you remember the olecranon is about the 5th intercostal space, so the 6th would be a little more accessible. And first of all, the periosteum is incised. So there you see the edge of the periosteum, and the edges are peeled away on both sides then. And then you literally cut through the rib, and then you just remove that whole rib. So that resection has now been done. And we're looking at pleura right now. When we look at this more closely, that probably is a combination of periosteum and pleura, because the periosteum didn't stay with the bone. And so we are looking at a surface of the inner periosteum there. What we're going to do is we're going to actually cut out a slab of ribs. So you're just going to cut through all of that. We've got a whole big slab of ribs. The scapula gets in the way a little bit. Just going to remove all of that. And you can see the basilar border of the lung right there. The ventral border of the lung is a little hard to see. We really aren't quite, but that would be the part covering the cardiac notch, really. And then the cardiac notch itself could be seen. The heart we really can't see at this point too much. We can stick our fingers right down into that phenococostal recess. Another name for that is costodiaphragmatic recess, where the pleura reflects from the ribs onto the diaphragm. To mediastinal recess, where the fingers are going right there. it tells us to cut through the trapezius and latissimus dorsi. You need to stay up fairly high. Notice how high that cut through the trapezius is. It's up pretty close to the midline, and we're cutting through that thoracodorsal fascia. And you need to do that so you can see that rhomboideus, which is going to be what we cut next. And so the latissimus dorsi has been cut, and actually the trapezius. Now we're going to cut through the rhomboideus next, as well as the, I believe, the serratus ventralis. And you might want to adduct the limb a little bit to help. First, what is what?
Well, this is serratus ventralis.
Okay, there is. Oh, so there is some serratus ventralis cervicus there, and then that's all the rhomboideus. So we're going to cut through those at this point. Cut through the extrinsic muscles of the shoulder here, and including part of the brachiocephalicus, even though it doesn't really